I'm Dr. Reena, founder of RW Perio, which is our specialist periodontal clinic based at Harley Street, and I'm also the founder of Perio School, which is our global teaching academy. So periodontal treatment is definitely the one that you start with. That is a no-brainer, no compromising on that. You've got to get the periodontal health stable, maintained prior to intervening orthodontically, and that's super important to prevent any complications. So to start orthodontic treatment, someone needs to be periodontally stable, ideally. So you want to have finished your active treatment, and ideally they need to be on a maintenance plan, and they need to be stable throughout that maintenance plan before you start planning and commencing orthodontic treatment. And this is really important because if you intervene too early, or if you intervene when the periodontitis hasn't been addressed, there will be severe complications and ultimately potential tooth loss. One of the biggest medico-legal issues right now is perio-ortho, and there are unfortunately so many cases that we're seeing currently where someone has started orthodontic treatment and not checked the perio, or not actually treated it to a good level, to a level where it's stable and safe to intervene. And this is an absolute must. No matter how much a patient is keen to do ortho and pressurizes us, we've got to get the foundations healthy first to prevent any complications long term. In terms of common problems during orthodontic treatment, especially for periodontitis patients, so patients who've had periodontitis in the past, firstly, it's relapse. So if someone's oral hygiene is not optimal throughout the treatment, if they haven't been having maintenance on a regular interval, which would be prescribed by their dentist or periodontist, they are at high risk of relapse through orthodontic treatment. It's hard, especially if you've got fixed appliances, it's much harder to clean around there. But even with Invisalign or removable appliances, it's still a risk factor. So relapse is a key one, and it's really important if there is relapse that we pick it up and address it as soon as it happens to prevent any issues going forwards. The other one is also gingival enlargement, especially around fixed orthodontics, and you can get gingival enlargement especially if the oral hygiene is not optimal either. Other things as well, things like root resorption, things like mobility increase, all of those things need to be taken into account. And of course, one of the key ones is gum recession. So if someone's got a very thin phenotype, you might start noticing more and more recession as the orthodontics progresses. And again, this is the kind of thing you want to warn your patient about beforehand, so there's no surprises and you can manage it. You've got a plan to manage it long term. So in terms of combating these issues, firstly, if there is relapse, firstly the dentist or dental professional should be checking, they should be probing, ideally every visit, and checking for any periodontal relapse. And if there is, pause the treatment, get that sorted, involve a periodontist if you need to, get them back on track, pause the orthodontic, so if they're on a certain aligner, pause there, and then continue once they're stabilized. Things like gingival enlargement, often it's addressed after treatment, unless it's very severe and it's interfering with the movement. Often non-surgical is okay, but sometimes we do need to do surgery to address that. Things like root resorption, mobility, is something that we sometimes monitor, but if it gets too extreme and the risks of continuing orthodontic treatment outweigh the benefits, then sometimes you do have to stop orthodontic treatment. I think at the end of the day, we've got to keep it super patient-centered and make sure that the patient is aware of the risks and we're only doing what's in their benefit. The future of perio is super exciting. I mean, already in the last sort of 5-10 years, so much has changed with the techniques we have. For example, post-orthodontic treatment, we might have recession, and the techniques and the types of surgeries we have now to be able to address that are super predictable. And when patients have good bone levels, we're able to achieve very good coverage of the roots. So there's that sort of surgical advancement side of things. The fact that also the surgery, it's microsurgery using microsurgical instruments, the pain and there's afterwards is minimal disruption to their lifestyle. I think all these things, sometimes when we're taught at dental school, we thought, oh gosh, surgery, it's a massive surgery, loads of side effects, patient's gonna be out of it for a few weeks. It's nothing like that because of the way we treat it now. So advancement surgically is a key one. And also I think with perio, we're really working very closely now with multidisciplines, including orthodontics as well. So, so even like the equipment a lot of people use with ortho, such as the iTero scanner, we use it all the time to monitor recession because we want to use a time-lapse function to see if there has been any progression. So it's also about the technology side and making the most of that for our perio patients and working in a kind of holistic fashion. And taking taking a step out of kind of just dentistry, with perio, the future is really holistic health, and your gums are literally the portal to the rest of your body. So now there is a lot of interest in other risk factors, nutrition, stress, working with our medical colleagues to really look at the patient as a whole and look after them as a whole to get the best results. At the London Dentistry Show, I'm going to be providing an overview of the perio-ortho interface. And starting from the beginning of the patient journey in terms of what should you be checking in your patients prior to orthodontic treatment, what should you be looking out for during the treatment, and what can we do afterwards as well. And we will also be specifically focusing on periodontitis patients. So patients with quite significant bone loss, how do you treat those patients? Because yes, health is important, but soon after, aesthetics is also important, and we want to try and help our patients with that. So we'll be talking about all those different things, making it very practical for you in daily practice, and sharing a few tips and tricks which hopefully will help you all. So the best way to get in touch is probably via our social channels and our Instagram. My personal Instagram is just my full name, Reena Wadia. We've got our clinic Instagram, which is RW Perio, and then our teaching Instagram, which is Perio School, so it's perio_school. So you can either kind of message us on there or drop us an email, whatever is easier for you. I would just add that perio is, I know I'm biased, but the most important specialty, and it can really bring together your restorative aesthetic cases. And I would certainly say for all the dentists out there, one skill that I would highly advise everyone to learn about is crown lengthening. And this can come in real use for your, following your orthodontic treatment, and even just in general practice in terms of restorative crown lengthening. So yeah, check out our courses on Perio School. We've got a one-day crown lengthening course for all dentists. We do live surgery, hands-on, one-to-one. It's absolutely amazing, provide mentoring after. So if you're interested in that, let me know, and would love to have you in one of those groups.